Hair loss in women is a deeply distressing phenomenon.
This morning we're talking about hair loss.
Hair loss.
Hair loss. 50% of women by age 50 will have hair loss.
Hair loss is extremely psychologically tolling. Is that even a word?
Oh my God! Oh my God!
Unfortunately, it happens to 50 to 70% of women ages 50 and above, basically in line with perimenopause and menopause, along with all the other changes that happen with changes in our skin that we've talked about, as well as changes in our facial structure and laxity, all the things that contribute to aging. On top of all that, there's changes in the quality and the quantity of hair. And unfortunately, this topic is filled with so many misconceptions. This is a topic that is near and dear to me because not only is my wife in this specific age, and I know over the years how conscious she's been about hair loss and the measures that she's taken to prevent hair loss, but as well as our community friends. And it's just a hot topic. It's a topic that is understandably very, very concerning. And ultimately, it rests in the center of youth and beauty, as well as the foundation of what it is that helps us look as young as we feel, right? I mean, that's what all these anti-aging measures are about. As long as we feel youthful on the inside, we want our appearance to match that. And with female pattern hair loss, it's a condition that often worsens with age. So to get this right is extremely important. And that's what the topic today is going to be about. It's going to be about breaking down what is the root causes of hair loss, as well as what can be done. I've taken the time to really do the research and really try to understand what we can provide in terms of recommendations that are not based on fluff, but in truly proven studies to back everything that I'm about to say. So let's get into it. Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're gonna talk about hair. Let's break down the anatomy a little bit. So anatomically, the hair is made up of a follicle as well as a shaft. Now, the shaft, which is the portion of the hair that we see, is composed of an outermost layer, which is the cuticle, which gives the hair the shiny quality to it. The inner layer, which is the cortex, gives the hair the texture as well as the color. And then the internal layer, the medulla, gives the hair its thickness. The life cycle of the hair is really important to understand because it's at the core of everything that I'm about to talk about. So you have basically three cycles. You have anagen, you have catagen, and then you have telogen. Anagen is the hair growth phase. That can last anywhere from months to years. Then you have the phase of hair where it's transitioning. That is catagen. Catagen is basically where you have literally no hair, but the hair is starting to transition to resprout. When it comes through, then you're in telogen, which is basically like a resting phase for the hair. And then it starts to go back into the growth phase. So this cycle is really what happens on a regular basis in healthy hair, but what ends up happening is hair begins to fall. It starts to get to a place where the cycle basically terminates. So hair stops growing, hair stops transitioning, and then you therefore end up in a situation where you have permanent hair loss as a result. This is what we're trying to counter with treatments. This is what happens at the core of hair loss. So what are some of the signs of hair loss? So basically, Ludwig's classification is a clinical classification that is used to describe what phase or what level of hair loss we're seeing in female pattern. So basically in the phase 1, there's just diffuse little hair loss. You can't really tell too much. Covering the hair is very easy to do. The second phase, which is the second classification, you start to see a widened part. That's typically what ends up becoming much more noticeable. It's harder to cover. And then the third level of classification is where you have diffuse loss throughout the entire scalp. Hair is overall very thin. Most likely the most common type is type 2, where you have this widened part that effectively is because of the fact that the hair is low in density, therefore the part is just very diffuse and wide. This is something that we see more commonly as opposed to global or diffuse loss that you see in type 3. In addition to the visible changes that you see when you look at the actual scalp. Also, people become aware that they're losing hair by what's left in the bottom of the sink or the shower or in their comb. As we increase our age, hair loss it becomes accelerated. So you start to see clumping of hair, greater amount coming out when you're combing your hair, etc. That is often a very disturbing and telltale sign that this is a pattern that is starting to happen as we're losing more and more hair. Why does hair loss happen? Effectively, the most common pattern or most common reason hair loss is happening in women is a condition called androgenic alopecia. And androgenic alopecia means it's related to hormones. And oftentimes the hormones that are contributing to this is the imbalance that happens as we go through the different stages of life, where the androgens become a little bit more prominent relative to the decrease in estrogen. And as a result, this contribution, which we don't quite understand exactly the mechanism, seems to be an underlying reason why this happens. When it happens, the decrease in estrogen relative to testosterone, what ends up happening is you start to see not only changes in your hair, but you also see changes in your skin, as well as changes in the facial fascia, which we've talked about in many past videos, where shape change of the face, changes in the quality of the skin, changes in the hair, all contribute to an overall aging look. And this is really, at the end of the day, a complicated and complex set of changes that are happening, but also deeply disturbing for people who are going through it. And being in a profession where I truly help patients on a daily basis with this type of situation on all aspects of facial aging, I can understand and sympathize and really empathize as I get a little bit older and have some of these same things to deal with and worry about and try to figure out for myself, as well as for my wife. It is definitely something that is top of mind as we start to age. So if you're feeling this type of thing, recognize that you're not alone, recognize that you're going through this with literally everyone else. As I mentioned, 50 to 70% of women go through some level of androgenic alopecia, and as a result are basically experiencing everything that you're experiencing. In addition, if there are genetic reasons, like if you have a genetic pattern there, it's gonna increase the likelihood of these things occurring. So it's important to look at what mom and dad look like with their hair loss patterns, because it's gonna be a contribution there, as well as some other type of lifestyle factors. For example, if you're feeling a lot of stress or you're going through a lot of stress, you can have an accelerated hair loss that happens as a result of that. It's a very common instigator of hair loss that occurs is stress, as well as diet. Diet deficiencies of certain nutrients, iron, for example, as well as proteins and other types of nutrients that we talk a lot about in our past videos of supplementation, etc., can have a very, very powerful role in hair loss as well. Sleep can have a very, very powerful contribution as well. There are also medical conditions, which I'm not gonna get into deep conversations about here, but there's things like polycystic ovary disease, as well as hyper or hypothyroidism. So these are things that can also cause hair loss. These are the reasons why if you go to your dermatologist or doctor and you complain about your hair loss, perhaps given the set of things that are going on, they may wanna do some blood tests to check your iron levels. They may wanna check your thyroid levels. If you don't have any signs of hyper testosterone, for example, you don't have hair throughout the face, or if you don't have any other sort of telltale signs that you might have a polycystic ovary disease, you might not need to have testosterone tested directly, but iron as well as thyroid is gonna probably be a test that your doctor is gonna wanna do for you to rule out some of these other deficiencies, as well as basic metabolic factors like hyper and hypothyroidism. All right, so now let's talk a little bit about what can you do? What are some good basic foundational things that you can do before we get into the conversation about medications and things like that? What are some of the things that you can do to decrease hair loss and just make the scalp a healthier place? So here's some concepts. So number one of the reasons why this occurs in conditions related to the scalp directly are related to clogged pores on the scalp. Additionally, things like inflammation. Now, there could be various causes of inflammation, but if the scalp is inflamed, you want to do things that are going to decrease inflammation, which we're going to talk about in a moment as well. So cleansing, using shampoo to wash the hair, unclog the pore, manage oil production, which we'll talk about in a moment, are things that can actually help improve scalp health. The typical recommendations and studies show that washing your scalp 5 to 6 times a week. Now that might be a lot for most of you. A lot of people don't wash that often. And I can't advocate one way or the other. I'm just expressing what some of the literature shows, that 5 to 6 times a week of hair washing tends to be the sweet spot for improving the overall scalp condition, decreasing the potential for any type of inflammation related to even having fungal type overgrowth or any of these other things that can enhance or worsen the hair loss pattern. And this is one of the things. And some of the keys is you want to use a very gentle shampoo as well as using a conditioner to hydrate and moisturize the scalp at the same time. And when I mean gentle, I'm talking about sulfite-free shampoos, which sulfites can dry the scalp and they can dry the skin in general. So a sulfite-free shampoo is something to look for. Some additional ingredients to look for in a very mild shampoo is those that have mild surfactants listed here. So take note of these, take a screenshot. These are the ones that you want to look for in your shampoo, and you want to avoid the sulfates. Now, when it comes to shampoo and conditioner types, we're gonna put together a PDF that will summarize some of the things to look for oily hair, dry hair, specific types, mix and match the different recommendations accordingly. We'll put them on the PDF. You can go ahead and download those, and basically as it functions as a cheat sheet, in addition to a lot of other things that I'm gonna be talking about in this video, specifically when it comes to the drugs and the different types of treatments that you can benefit from. So look out for that PDF, download it, and go from there. But you definitely want to download that and learn a little bit more about it. The next scalp health topic is hair oiling. Now, this is what's interesting about hair oiling. It is one of the most commonly used practices in almost every culture throughout the world. We're talking about African culture, Chinese culture, Indian culture, all different cultures throughout the world that have been using hair oiling as a way of creating good scalp hygiene as well as good scalp health. And what I find interesting about this is in my own family, my uncle has one of the fullest heads of hair of anyone in the family. And at age 65, he still maintains a very full hair. And one of the things he told me was that he has been using hair oil, basically almond oil in his case, 15, 20 years. He's been using this as part of his thing. And then as I'm doing this research, I recognize that this is something that has actually been studied and discussed and talked about and reported on. And let's understand this a little bit. One of the things I mentioned is clogged pores can be a reason why the scalp can have issues related to hair loss. Additionally, inflammation. Well, a lot of these type of oils, coconut oils and some of these other type of oils can be very good from an inflammatory point of view, but also when you add oil to the skin, just like we do, actually, interestingly, that's one of the things that we do to decrease pore size. When I formulated the trifecta in the Illuminate, we add oil, lipids, to prevent the skin, or in this case, the scalp, from producing oil. Because if it doesn't produce oil, it can't clog the sebaceous gland, and therefore the duct doesn't end up becoming dilated and a pore gets created. Well, in the scalp, if a pore gets clogged, well, that has a contribution to hair loss, as well as many of these oils can become very anti-inflammatory. So this is something that's actually been used and studied, and I think it's a pretty benign thing to add to your overall regimen. I might actually start getting back into it again. I was doing it for a little while and I kind of slipped off, but I think this is something that is definitely worth doing. Now, if you do this, you're going to be doing it 1 or 2 times a week. You don't need to do it every single time. You take the oil, if it's coconut oil, usually because that's a saturated oil, you basically melt it, you put it onto your scalp, leave it on there for like an hour or something like that, maybe 2 hours, and then you can wash it off. Additionally, argan oil is another one that's talked about in this way. The almond oil that my uncle uses, I didn't see much about it, but again, it's something that he's personally done. I don't know exactly where he got the information from, but it is certainly something that it seemed to have helped him from what I've seen. But these other ones that I've mentioned, argan and coconut, are definitely helpful for moisturizing, and all the other things that we just talked about for scalp health. Now let's talk about a balanced diet. Our scalp is literally made of skin. We've talked about the importance of treating the skin literally like another organ in our body, because it is. It's the largest organ in our body. So the things that we eat, the deficiencies in our diet, etc., can have a direct impact on all the organs in our body, but specifically in the case of skin, it can have direct effect on collagen production. Hair is another one, keratin is another one. These are things that rely on certain types of building blocks to basically flourish and grow. So the key ingredients in your diet that you want to make sure you have are going to be things like First of all, protein is an important part of everything. You want to also make sure you have vitamin D, vitamin B, as well as iron. Now, iron is found usually in red meats, as well as green leafy vegetables. Vitamin B, in biotin, for example, you might have heard of it as a supplement, and I talk about it in one of our past videos on oral supplements worth taking, can be found in whole grains as well as eggs. So make sure that your diet is well-rounded and it doesn't have any notable deficiencies in the things that we just mentioned. You can definitely see how somebody who's a vegan or vegetarian who isn't very thoughtful about making sure that they're getting some of these other aspects where they're going to be iron rich can easily become iron deficient. And this is something that's very important. We see this a lot, unfortunately, people who take meat out of their diet and don't supplement properly with either oral supplementation or the use of the proper type of dietary foods that are rich in iron. Me, myself, I actually don't eat a lot of red meat. I do eat meat, but I don't eat a lot of red meat. But I eat a green smoothie every single day that is packed with kale and chard and spinach. And that's where I think I get the majority of my iron. But from time to time, I will eat some red meat and get some that way. But that is an incredibly important part of the overall diet and easily one that is missed. The next one is stress. Now, stress, it could be an acute stressor that results in hair loss, or it could be a constant stressor. And as you know, stress impacts cortisol levels and all these different hormonal levels have effect on a lot of different systems in the body in a negative way. So you want to do things that are going to decrease your stress in life, because hair loss is definitely one of those things that can be affected by either chronic or acute stress. So things like meditation, exercise, decreasing life stressors, being mindful about some of these things can really, really make a big difference in your overall health, as well as the health of your head and your hair. Another one that I think pertains specifically here to women who overly style their hair, put a lot of product into their hair, use tight hair bands, basically ponytails that are very tight, etc. All those things can be very negatively impactful on the scalp health as well. So hairstyle, how you treat it, the products you put on it, you want to minimize that as much as possible. Allow the hair to basically function without being tight, without having a lot of different chemicals and different things like that on it. These are all just good general practices. And again, in the PDF, we'll review some specific hair tactics and techniques that can have a positive and a negative effect on the hair. So you want to definitely look at that. The next one is sleep. Now, sleep is at the core of so many different things because sleep keeps us healthy. 1 or 2 nights of bad sleep, you see it right on your skin. I would talk about this all the time. Your skin literally can tell if you've been sleeping or not. It just looks gray and ashen and it just looks tired, right? Well, the scalp is a continuation of skin. If you're not getting good sleep, you're not taking care of your rest, what happens during sleep is the hair growth phases are actually accelerated during sleep, in addition to all the other kind of healthy bodily things that are happening. Cortisol levels diminish, testosterone levels balance out. All these things are positive things are happening during sleep. So sleep is one of those things where you want to make sure you concentrate on. You try to, plan for it. Give yourself at least 7 to 8 hours if you can to get that full night of sleep. That'll have a very, very strong effect in the long term when it comes to hair health. Again, I'll go into detail about this in the PDF, but sleeping with a silk pillow, decreasing friction, not keeping your hair in a tight bun. Sometimes people go to sleep with wet hair, for example, then the hair gets into a little bit of a tangle that puts friction onto the hair. Also sets up for just an overall unhealthy condition for the scalp, depending on the level of humidity, etc. So these are some often overlooked minor things that can have big effects in the hair loss pattern, basically, and accelerate hair loss that might be occurring. So now we're going to talk about the real bread and butter here, the thing that frankly I think is probably the most important part if you're serious about preventing or restoring some of the hair loss. And it comes down to medicine, unfortunately, right? And with medicine, there's always pros and cons, there's always side effects and all those other things. But the ones I'm about to mention, generally speaking, are very low on the side effect spectrum, but also have real proven impact. And probably the most common one, and you're gonna wanna pay attention here because there's some things here that you may not have heard about. I should also say this, you're gonna definitely I insist, before you consider trying any of these different things, or even if you're in this position, you definitely want to have a meeting with your dermatologist or your primary doctor to discuss your concerns, have them look over everything, again, as I mentioned earlier, certain blood tests, etc. But when it comes to these particular medicines, many of them that I'm about to discuss, they're prescription only. So as a result, you're going to need to be able to talk to your doctor. This particular one is sold over counter, and that is minoxidil. Minoxidil, I think between 2% and 5%. I think 2% is FDA approved, 5% is commonly used with men. I think nowadays most women are using the 5% as well. But the concept here is minoxidil is a topical agent that is used to basically increase growth of hair. What it does is it increases blood flow to the scalp, as well as overall increases the phase where the hair is growing. So minoxidil is probably one of the most commonly used topical agents. It's used as a drop or a foam massaged into the hair, used typically twice a day. Now, what's interesting and exciting is there's an oral form of minoxidil that has just recently been, I don't know if it's recent, it just recently came to my attention, but has been used more commonly now. This is a lot more convenient, by the way, than topical, because a lot of times people complain of greasiness and just, it affects their hairstyle, affects the look of the hair. Orally, it's taken at a very, very light dose. Again, I don't want to go into specific details about, because a lot of this stuff is being used off-label. So you're going to really have to have a conversation, and every dermatologist and hair specialist I've talked to talks about a different dose here. So this is also one of those things where you're going to have to go to somebody you trust. Generally speaking, it doesn't take a strong dose to be able to get the changes that you're looking for. So this might be a very, very good alternative to the topical minoxidil, something you just take once a day and you continue taking. Now, the deal with minoxidil is that once you stop taking it, the hair that you would have lost will be lost, right? So once you start down this road and you're preventing the hair from losing, you're gonna wanna continue on, otherwise you're basically back to baseline once you stop. So that's one of the caveats to this, but it's also, if you're mindful of just wanting to be preventative, you can hang on to a lot more of your hair this way, oral or topical minoxidil. The next drug is finasteride. There's also a duestride. These are basically enzyme inhibitors that prevent the conversion of testosterone to 5-HT. And what happens there is basically once it prevents that conversion, the thought is you're decreasing the effect of the androgenic effect. Androgens are like testosterone, have the androgenic effect of these hormones on alopecia or hair loss. This particular drug is usually given to men with the potential side effects related to sexual side effects, etc. But topically, it's been increasingly being used for women. I'm not honestly terribly aware of oral finasteride being used for women, although I've heard about it, but I'm not aware of what the parameters are. Again, this is a conversation you might want to have. But topically, it's being used in solutions, which I'm going to talk about in a minute, something that I personally use, again, as an additional medicine for prevention of hair loss. Finasteride and duestride are very, very powerful, very effective, both in the form of oral as well as topically. The topical form has the advantage of decreasing the side effect profile systemically, right? So that's something to be considering, and happy to basically have a topical version, unlike the inconvenience of using topically with minoxidil. Here, I don't think you want to get this stuff into your system and affect overall hormone-related balances. Now, the caveat here is that even though it's highly effective, about 80% effective, minoxidil, by the way, is around 50 to 60%, 80% effective, but it's usually reserved for people who are postmenopausal and have more or less severe hair loss. But again, a lot of times you don't want to get to the place where you have that severe hair loss and you want to basically prevent the hair loss. So this is a caveat, right? So you have to make a decision here if you want to get on these things before you've lost your hair to basically prevent the hair from being lost. Personally, I think that's a better way to go, because these things don't necessarily grow hair back, they keep hair from being lost. Now, for people who have inflammatory conditions on their scalp, oftentimes drugs like ketoconazole, which is an antifungal, as well as certain steroids, can be given as a prescription to help decrease the inflammation. They can be also given in a topical form, used in a compounded regimen that really ultimately helps hair loss by basically throwing everything in the kitchen sink additive. This is what I personally use, and I get this compounded by a hair transplant specialist. They're also on a number of different websites these days. I think Happy Head is one of them. Him and Hers is another one where you basically have an online consultation with, and then they give you these prescriptions. But basically, the strategy there is you're taking minoxidil, you're taking finasteride or duestride, you're taking a corticosteroid, which is just a topical steroid. You're also often taking a retinol or retin-A mixed in there. You put all that together, and basically, through drops, topical drops, you're basically addressing multiple different aspects of hair loss and hair loss prevention at the same time. And that's my personal approach with it. That's what I do. I think it's helping me hang on to the hair I've lost, and preventing more hair from losing, and as well as just kind of thickening the hair as well. I'm gonna talk to you more about exactly what I do and what my wife does as well at the end of this conversation. Non-medically, but also requires a doctor, is PRP, platelet-rich plasma. So basically what happens here is blood is drawn from your arm or wherever, and it's taken in a centrifuge down. The red blood cells are removed. Now you got your plasma. In the plasma is filled with different types of growth factors, etc. So you're taking these growth factors and you are then injecting it into the scalp. And when you do so, basically what ends up happening is you're increasing growth factors that are gonna promote hair growth, hair health, all these other things. So that is basically a very, very common treatment and a very successful treatment in thickening the hair, improving the quality of the hair, and overall decreasing hair loss from happening. So it's a non-medical in the sense that it's not medicated, but it requires obviously a doctor or a nurse or nurse practitioner, physician's assistant, whoever, to basically go through this process with you. We do this in our office. We've definitely seen great results with it. I haven't heard anything negative about it. It's a little uncomfortable getting the needle stick, so you obviously want to make sure you're going somewhere where they use good hygiene and good technique, etc., so you don't pick up any infections. But overall, definitely a treatment that I consider worth doing. The next treatment is red light therapy. You guys have heard me talk about it when it comes to overall skin. I've even talked about it, when it comes to the hair health. But this is something that by itself, honestly, doesn't have a lot of merit. Like, it doesn't probably move the needle by itself. But there have been studies that show that when you combine red light therapy with minoxidil, for example, you get an elevated percentage of success. So the combination seems to have some synergy, but there's very limited studies that really can get to the bottom of it. But I definitely would say this is one of those things that's absolutely worth trying. Why not? It's relatively inexpensive, easy to do, very convenient. It's just a little hat you put on your head. My wife does this. I do this. I've been doing it for probably about 10 years or so. Watch TV, you have the thing on your head for about 30 minutes every other day, and that's it. Blood flow is the underlying mechanism of action, as well as decreasing inflammation. Seems to have a positive effect. One final thing related to medical treatments, and this is something that I can't speak to from the point of view of whether this is something you want to do or not, but basically hormone replacement therapy for people who are in that perimenopausal phase or about to go into menopause, and there's always that decision of whether or not you want to do HRT. This is a conversation you definitely need to have with your physician, as well as your background, health history, etc. But affecting this overall hormonal balance can preserve and improve the hair. I mean, this is something that's been shown. It's also something that is a very personal and very medically oriented type of decision. A lot of information that needs to be discussed along there. So I'm not going to get into great depth with it, but I just want you to be aware that this is something to bring up and discuss if you want to use it for other reasons in addition to hair loss. All right, and the final part here is supplementation. So as I mentioned, if you're deficient in your diet for certain types of supplements, taking these supplements can definitely help. We talked about iron, biotin, which is a vitamin B, vitamin D, etc. There's also products that are out there. For example, Nutrafol is one that's very popular, that's been used a lot. I actually use Nutrafol. I've been using it for several years. There's some type of proprietary herbal combination in there. I don't know, I really haven't gone into the depths of understanding whether or not these things actually have been scientifically shown to make a difference or not, but I figure, it's a little bit of nutritional insurance because, like I said, I don't eat a lot of red meat. If I'm deficient in one thing or another or something else, that this makes sure that I'm getting it into my diet. I certainly don't see there to be any kind of negative impact from using supplementations like this, other than the fact that they're not cheap. So, but if you're on a budget, I would say stick with the diet. You probably don't need anything in addition to that from a supplementation, but just be aware of that. And finally, the elephant in the room is hair transplantation. Unfortunately, hair transplantation doesn't work so well with diffuse hair loss that happens in women. A male pattern hair loss, you're losing, you're receding your hairline, you want to bring some hair from the back of the head and bring it here. It works very, very nicely for those type of things, or adding density, because the back of the hair in men tend to be thicker than the front end. But the problem is, if you're having, say, type 3 or type 2 hair loss, you're gonna see diffuse loss, and pulling hair from different parts that are being affected by hair loss already doesn't do anything. So candidacy for female hair transplantation is something you definitely want to take up with your hair transplant surgeon and understand, what type of hair loss you have and whether or not hair transplantation is a good treatment or not. But generally, just know that it's not like the slam dunk that it can be in certain male pattern hair loss. All right, so in summary, this is what it comes down to. First things first, take care of your stress levels, take care of your nutrition, take care of your sleep, take care of your overall health. That's foundational, right? Then you've got the inevitable, the hormonal changes that are going to happen. Literally, they're changing from even 30s and 40s, and then really accelerate after 50s. With the statistics that I shared with you, everyone's going to have generally some level of hair loss, postmenopausal especially. So this is where it comes down to, if you really want to get granular here and really want to get proactive, you might want to consider doing the minoxidil treatments, possibly proactively considering doing finasteride or duesteride combinations topically, and PRP, by the way, I put into that same kind of category. These are things that you would do to basically keep the hair that you have, right? Red light therapy, the topical medicine that I just mentioned, all these things. I would probably approach it multifaceted like that. So what I do, Netta manages with the red light. She doesn't do PRP yet. I do Nutrafol. I do the compounded mixture of the different type of things. I put it on my head once or twice a day, and I try to take care of the foundational stuff. So that is my general recommendation. I think the pros are greater than the cons when it comes to preserving your hair, and I think the sooner you get sort of motivated to do these things before you lose a lot of hair, the happier you'll be ultimately. And but once you start down this path, you got to realize you're going to commit to it and you're going to stay with it, because stopping at any point, you're just going to play catch up and lose the hair. All right, folks, that was a lot, but I think it's very useful, very helpful information that will really put you in a position in the driver's seat when it comes to these topics, and really understand what your choices are, etc. I hope you enjoyed this topic. I hope you share it with some friends and family who are going through it. Like I said, this is a pretty ubiquitous problem. Let's get the word out. Let's help people learn about how to manage all this. And if you enjoyed this, hit like. If you're not a subscriber already, make sure you subscribe to my channel, and also download the PDF that I just mentioned. I'm going to summarize a lot of the things that we just talked about here. And if you have any questions, comments, anything, drop them in the comments. I will do my absolute best to answer as many of them as I possibly can. I know this is an important topic, and I want to be there for you guys. Thank you so much, Dr. Amir Karam.